Hello, everyone, and welcome to the state of Kentucky for Friday, March 13th, Friday the 13th. This is a new show that we are starting to do every Friday at noon. We will pick it up and do more of them if we get enough interest and if we see the need. Today, of course, the news is pretty much coronavirus news all the time. So we're going to talk mainly about that, but we have a little bit of Kentucky General Assembly news as well. Let's talk about coronavirus just quickly. There are 11 confirmed cases in Kentucky. It's unknown how many are actually infected, of course, because testing is limited. We have very little access to tests. There have been multiple cancellations. You can go to all your regular news outlets and see those. The interesting or the probably major piece of news is that the governor has recommended that schools close for 2 weeks starting Monday, plus spring break. If they have a spring break in there, add that to it. So, for instance, some school systems are going to be closed for 3 weeks. There's a lot of other news out there, but I wanted to bring in somebody who has perhaps some special insights into this. Anna Weitz is a Frankfurt lawyer, but one of her practice specialties is working with healthcare providers, and she has done some things and has some information that I thought would be worth sharing. So let's add Miss Anna Weitz to our show. Welcome, Anna, to State of Kentucky.
Thank you. It's a pleasure to be here.
So you had sent me an email that was about some practices that some healthcare professionals are taking with regard to this. Can you go over some of those and explain that email?
I sure can. The CDC, the Center for Drug Control, issued some guidance to healthcare providers, and it is long and complicated. So in meeting with my clients, we went through it and tried to develop some 10 points that are really helpful to keep patients treated promptly and staff safe. We also wanted to allay staff fears that if they were sick or had childcare problems and had to stay home, that they would earn disciplinary points or use up their leave time and be terminated. So we included common sense things like wash your hands a lot, keep social distance. We also reminded staff that they could go into negative leave time balances rather than getting in trouble for many days off for illness or childcare. And some things that I just thought were good healthcare practices, like every time you get home, take off all your clothes, leave your shoes outside, let the sunshine do its thing to your shoes, and put on something fresh and clean in the house. And more importantly, probably do that for your children or anyone who's been around somebody sick. So we just wanted to make sure that everybody had good ideas and a simple way to share it with staff without scaring them. Also suggested that hospitals and clinics may be asking patients to give them a cell number and to wait in their own car rather than in a crowded waiting room, just to avoid that cross-contamination.
Sure. I should have put this up earlier. I'm going to share it right now. If you comment on Facebook or YouTube, we can see the comments and we may share them in the broadcast. So you had a second thing you sent me that was about telehealth. Could you talk about that for a moment?
Yes, we are very, very lucky in Kentucky that an intentional rhyme that last year Kentucky's telehealth laws changed, and so many certified and credentialed providers, doctors, hospitals, counselors can see patients via telehealth. They can talk to you on your smartphone if you have an enabled app, or via computer, your home computer. A lot of us use not telehealth, but the online doctors through our insurance, and that makes access very easy for patients, and it's useful for doctors. The big thing with Corona is keeping that social distance, staying away from possibly infected people. And so we are encouraging providers. I'm reaching out to all my clients and everyone else to say, really leverage telehealth. And it came to my attention this morning that there are certain classes of providers, particularly in the substance abuse field, who aren't allowed under Medicaid or some commercial insurance to use telehealth. The peer counselors who check in with patients every day can't use telehealth and be paid for that. The case managers who listen to the patient twice a month and say, okay, this is your next appointment, here's your schedule, how are you doing, also can't use telehealth and be reimbursed. And under Kentucky law and federal law, a doctor can't prescribe a controlled substance via telehealth except in very narrow circumstances.
Okay.
And so we have hundreds of patients, probably thousands of patients across the country, across the state, who are going to have to go and sit in their doctor's offices to get that 30 minutes of peer counseling or that 20-minute doctor visit when they really could be doing it via telehealth. So I reached out to Medicaid in Kentucky, to the cabinet, to the governor's office, and to the telehealth steering committee for the state. I'm a part of that, to say, can we ask for an emergency regulation or an executive order that allows us to treat this really vulnerable population via telehealth? The idea of a month going by before a patient in early substance abuse treatment can be tested or treated or have peer counseling, get their medication, makes me nervous in a state that's hard hit by the opiate epidemic.
Right. I assume that since you just sent that, you haven't heard anything back yet. How do they do the emergency regulation? Does that have to go through the General Assembly, or can the health commissioner just put the regulation out?
This is a very unusual situation, and I presume that with the approval of the governor's office and Dr. Stack, that the state could put out an emergency order allowing this. What we're asking for is not anything really novel. It's evidence-based practice that is used in other states. I think it's Virginia and Maine in particular have used this for a long time, several years. And so we're not saying open season, do whatever you want. We're just saying let's treat patients in the most effective and germ-free manner.
Sure. Well, I hope that they do that and do it quickly. And if they do, we'll certainly report on it. And thank you for your work with healthcare providers, which are certainly an important and stressed group of people right now. So Anna White, thank you for your information.
Thank you so much.
All right. So it's a interesting time to focus on all these things. We are fortunate in Kentucky to have a state legislature, a state administration that's doing an awful lot about taking care of this. So one of the things I wanted to do was to show you the state website that is really well done. So let me just put that up on the screen, and we're going to go through it. It's really simple to remember. It is kycovid19.ky.gov. So kycovid19.ky.gov. This is an excellent resource. If we look at it, it starts out right up the top with the hotline that they recommend you call if you have any questions. And then underneath that, you can see all these links over here. They've got the response, everything Kentucky's doing. This is one of the most important parts of the site, when to seek care. This is a really good piece right here. If you are worried but well, please stay home. That'll just, if you go out, that'll just overload the, healthcare function. If you are ill but would not have sought care, then don't go seek care. If you want advice, call the hotline. And if you are sick and feel you have an emergency or you are injured, then please seek care. And then if you scroll on further down, they actually have a thing from the CDC on how to wash your hands, which everybody's making a point about. Who is at risk? And then they have information for specific audiences, including travelers, pregnant women, businesses, schools, large gatherings, so on and so forth. And then they have outlined their guidance for the community. And then at the very bottom, there are some videos from Dr. Stack explaining various things, including flattening the curve and so on and so forth. I would highly recommend that you go spend a few moments looking through this website. It really does a good job of explaining what we are doing as a state. And I'm very pleased about the fact that we have a state government that is doing things like this and putting it together. Let's take just a moment and talk about the stuff that the General Assembly is doing. So the General Assembly has taken off today and Monday, so they have postponed their work. They're supposed to gather back again on Tuesday. The governor has made it plain that the only thing that they have to do, and this is legally true, is they have to pass a budget. And the deadline to adjourn is in the Constitution, and so they can't necessarily move that either. Now, what they can do is spend whatever days they want to on doing the budget and getting it approved and sending it to the governor, and then they can adjourn early. They can always adjourn early. And there's been some discussion of doing that and then calling a special session later in the summer when supposedly the threat from the coronavirus will have lessened. That's all under discussion. We'll wait and see what happens with that. They have continued to pass some bills, but the budget, of course, is the main thing that they are working on. This is our first show, and we're going to try and keep our shows on Friday to about 15 minutes or so. So today, that's the main thing that we covered was coronavirus, and we want to thank Anna Weitz again for being part of the show today. I want to put that website up one more time, the coronavirus website for Kentucky, kycovid19.ky.gov. There's one more thing that I want to talk about, and that is supporting news people. You need to support three different things. You need to support your local news outlets, which would include your local newspaper and your local public radio stations especially. I would encourage you to do that. Most television and radio stations don't require memberships, but your public radio station certainly does, because that's one of the main ways they get their support. And you need to support your local newspapers. Newspapers have been in trouble for a long time, and they still are providing a lot of valuable local news, and you need to go subscribe. Second thing you need to do is you need to subscribe to the big newspapers in the state. That would be the Herald Leader and the Courier Journal. I subscribe to both, and I do it primarily because I want to see them continue to succeed. We need big news outlets like that in the state to cover the state well. And finally, of course, I hope you will become a member of Forward Kentucky. We are doing what we can. We would like to expand our coverage if we can. That's basic. We only get support from memberships. We don't take advertising currently. We don't get grants, none of that stuff. So if you want to support us, then become a member at that location there, forwardky.com/join, or you can go to the website and there's a menu for members. And lastly, we are going to start doing this every Friday. If you have ideas or suggestions, people you'd like us to interview or topics you'd like us to cover, you can send them to tips@forwardky.com, and we will take a look at them and maybe even include them in the show. But we are going to start doing this every week. And so we'll post these on YouTube and on Facebook, and you can watch them later. But you can plan around noon on Friday is when we are going to be doing these. I want to thank you for watching, and thank you for the people who gave us a thumbs up. And we will be doing this again next week. So thank you for coming to listen to the State of Kentucky.